Knock, knock. Hi, my name is Julia. I'm going to be your student nurse for today. I'm going to perform hand hygiene and provide privacy. Alrighty, can you verify your name and date of birth for me?
Jennifer Waters, 12075.
Okay, and is it alright if I touch you?
Yes.
Alright, I'm going to look at your wristband to verify your name and date of birth. And I verified it. Looking at my orders, the doctor has ordered me to do a head to toe assessment. Is that okay?
Yes.
Alright, is it alright if I touch you at any point during the assessment if I need to? Awesome, so we're going to start off and I'm just doing a general inspection. We're talking, I'm looking at your hair and your appearance, making sure that you're well groomed. You are well groomed. Your hair doesn't look like you had any obvious hair loss or anything like that. Your clothes are appropriate for your age, and your hygiene is also appropriate. I don't have any odor or anything like that. Have you been having any recent hair loss or rashes or anything like that?
No.
Okay, and have you been having any vision loss?
No.
All right, and do you wear contacts or glasses?
Both.
Okay, and have you been having any ringing in your ears lately?
No.
Any headaches?
No.
Any chest pain or trouble breathing?
No.
Alrighty, any recent surgeries?
No.
Alrighty, any problem urinating or defecating or going to the bathroom?
No.
Any cough or sputum?
No.
Okay, and sputum is like phlegm or anything like that, congestion and anything that you get. Have you been having any difficulty swallowing?
No.
Okay, and have you been having any drainage in your nose or anything like that? Okay, awesome. So as I'm asking you these questions, I'm just checking to make sure that you're alert and you're aware of your surroundings. You're making good eye contact with me. You're giving good verbal responses. You're also responding to me physically, and that's means that you are alert to just your surroundings. Have you been, and you don't have any recent vision loss, so you don't have any vision concerns or anything like that. And you have good speech and hearing. I'm also going to ask you a few questions just to, again, go deeper into your level of consciousness. Do you know where you are?
I'm in my office.
Okay. And you already gave me your name and your date of birth. Do you know what month and year it is?
It is October 2024. I was trying to figure out which day it is. It's the 3rd or 4th.
Okay, good.
But I can't
Alrighty.
remember.
That's okay. And do you know who the president is?
Joe Biden.
Okay, and that's just assessing your level of consciousness, which means you're alert to person, place, time, and situation. And then also you're aware of, based off of verbal, movement, and eye response. And so that's all part of our Glasgow Coma scale. It's supposed to just give us a base of your level of consciousness, but then also we use the Glasgow Coma scale to assess your responses based off of like if you've had a recent head injury. And you haven't had any recent head injuries, have you? Okay, awesome. So I'm going to move on, and I'm looking at your skin, and I'm just inspecting your skin right now. And like I said, there's no recent hair loss, there's no scabs, I don't see any, thing that suggests bad hygiene or anything like that. I'm looking at your nails, they're well groomed. And then I'm going to go ahead and inspect your nails. I'm just going to inspect the skin capillary refills. It's less than 3 seconds, which is good. I'm going to inspect your skin trigger right here. This is just inspecting the how much hydration you have in your skin. Okay. All right, and it recoils immediately. Alrighty, so the next thing we're going to do is we're going to inspect your head. Like I said, I don't see everything is symmetrical. I don't see any deformities. There's no drooping of your face or anything like that, and you haven't had any troubles with drooping or anything lately, have you?
No.
Okay, and then I'm also going to inspect your eyes. Thank you. Alrighty, can you remove your glasses for me? I'm going to assess your perla, which means I'm going to assess if your pupils are round, reactive to light, have correct accommodations, and are equal, okay? So I'm just going to, if you'll look at me, I'm going to shine a light in your eye. It's direct and consensual on both sides. And so they contract when the light shines on them. Alrighty, and I see that your pupils are round. I'm going to assess the size. Say they're about 3 right now, and then we're going to see if they, so they're equal, they're round, they're reactive to light, we're going to see if they have correct accommodations. So I'm just going to hold my pen right here, and then I want you to just look at it as I bring it closer to your nose, okay? Again, seeing if they constrict and expand, which they do, so they have correct accommodations. And then you haven't had any recent vision loss. I'm also going to assess your ears. I'm just going to make sure that there's no drainage. I don't see any lesions or anything like that. Alrighty. And then I'm also going to assess your nose. Again, I don't see any deformities or anything like that. No drainage or anything. We're going to test what we call the patency of your nose. So if you can just put your finger on your nose. Inhale for me. On the other side. Okay, no trouble breathing or anything like that. We're also going to assess your mouth. And so if you open your mouth for me, I'm going to assess your throat. Alrighty. Oral mucosa is pink and intact. And I don't see any tooth chipping or anything like that. Any white spots in your mouth or anything like that. You said you haven't had any difficulty swallowing. Can you swallow for me really quick? Okay, we just did a swallow test. I'm just going to feel your trachea to make sure that it's midline, and it is. And I'm going to move on to, we did your neurological, now we're going to move on to your respiratory. So I'm going to put this down. Alrighty, so for the respiratory, I'm just going to listen to your lung sounds, okay? And I would do this normally on bare skin, but just for video purposes, we're not going to do that, okay? You're welcome. Alright, so I'm going to listen to the right upper lobe. Okay. And you would take deep breaths for me, but again, I'm just going to show where I'm doing. So, right upper lobe, right upper lobe, left lower lobe, right lower lobe. Now have you take your arm and cross it across. Now do right middle lobe, and then do the same with the other arm, and do left lower lobe, and now do the same with your back. So I would do right upper lobe, left upper lobe, right lower lobe, left lower lobe, and right lower lobe. Okay, and I'll say that your lung sounds sound clear and unlabored. Alrighty. And I would also take your respirations at this point. And so while we do that, I'm just going to take your respirations. So if you can just relax for me, okay? Some respirations were 18. Now, next thing we're going to do is I'm going to educate you on the incidence barometer. So we have this incidence barometer here. All right, so what you're going to do is you are going to inhale to the level that you're ordered by your doctor, and you're going to hold it for about 5 seconds, and then you're going to exhale, okay, and then you're going to cough. So if you can just, and you're going to do this 10 times every hour or every commercial break, okay? Awesome. And then also, if you were bedbound, I would teach you the current turn, cough, and deep breath method, which is you would just turn to your side, you would cough, and you would take a deep breath, and then you would cough, okay? But you don't have to show me that. I would also educate you on the Braden scale. The Braden scale is just a scale that we use for anyone who is sitting down more to assess their risk of pressure injuries. And so 3 of the categories for that is nutrition, mobility, and friction and shear. And again, if you were bedbound, that would be something that we'd be assessing to make sure you don't have any pressure injuries or anything like that. All right, so now I'm going to move on to the cardiac assessment. And we already did capillary refill, skin trigger. I'm just going to assess for some edema. So if I can just see your arms. Okay. And then I'm going to assess your pulses bilaterally. So this is your radial pulse. About a +2 is the strength. And then I would do the dorsal pedis. Okay, +2 in strength, and then the posterior tibial. +2 in strength for both of those extremities. And then the other pulses are your carotid, your brachial, your axillary, your femoral, and your popliteal. Okay? And then I'm going to listen to your heart sounds. Okay? I'm going to do your aortic, your pulmonic, herbs, your tricuspid, and your mitral. And then I would turn the bell, and again I would do all of that on bare skin. I would, again for the video, I'm not going to do that. And then I would turn my stethoscope to the bell side, and I would listen for any murmurs. Alrighty, and then I would move on to the gastrointestinal after I would do all of that. So if I were doing the gastrointestinal, I would be doing this laying down, but we're obviously we don't in a situation like that. So in any other situation, you would be laying down. So we're going to simulate that. Alright, so I would again expose your stomach, but we don't have to do that, and I would just look for anything, any distension or anything like that. And then I would assess your bowel sounds. So I would do the right lower quadrant, the right upper quadrant, the left upper, and the left lower, and then I would turn my bell to the bell side again, and I would listen for vascular sounds. I'm going to do aortic, renal, and iliac, and looking for any bruise or anything like that. Alrighty, and then have you been having any stomach pain or anything like that? Awesome. And then after I would inspect the skin, listen, I would then palpate the same right lower, right upper, left upper, left lower. Okay? Alright, so now we're going to, and have you been passing gas and normally and everything like that? Okay, awesome. So now we're going to move on to your musculoskeletal. So what I'm going to do is I'm going to do a range of motion test. So I'm just going to grab your wrist, and if you could just do what we call hyperextension, which is lift your wrist up like that, and then bend it, which is what we call flexion. Alright, and then put it back to normal as extension. Okay, now we're going to do it with resistance, so if you could do that hyperextension again. Okay, and that flexion. Alrighty, and then the same on this one. So we would do this, flexion, extension, and then with resistance. And then we're going to do your elbow. Okay, so if you can just make a muscle for me, that's going to be your flexion. And then if you could just extend it back down. There we go, and I don't feel any crepitus or anything like that, and we would do the same thing on this one, okay? Now we're going to do your ankle, so I'm going to hold onto your ankle like this, alright? And if you could just do dorsal flexion, alright? And if you could point, alrighty? And then we would do the same on this, and then if you could just do your knee for me, so if you could just, yep, we're going to extend, and then we're going to flex, which is we're just going to put our arms back. Okay, and I don't feel any crepitus or anything like that, and again, I would do the same thing on the other extremity. Right, but for time, we're not going to do that. All right, and then if you could just stand up for me. All right. And then I'm just going to stand right here. We're just going to assess your balance, okay? So we're going to have feet together, and we're going to put my arms out here. We're just going to have you close your eyes, and we're going to assess your swaying, okay? And there's no obvious swaying. There's no obvious swaying. Nothing crazy, okay? And then we're also, if you can just walk heel to toe to right there and then back. Again, assessing your gait and your balance. Your shoes aren't helping. Awesome. So the only obvious thing is the shoes. Alrighty. If you can have a seat for me. Alright, and I think that is everything. So thank you so much. I'm going to get these findings to the doctor and come see me. Call me if you need anything.